So for this week's video forum, we watched a video by Stefan Klasko on what healthcare will look like in 2020. So overall, I didn't really like this video. Thought it was like way too much fluff. Like the whole, the TED Talks taking place in the future was kind of gimmicky. I think it really retracted from like the seriousness of what he was talking about, because I think healthcare reform is really important and we do need to move in a more focused direction when talking about it. I don't think that the healthcare system that we have in America especially is really good right now. And I had to hear about Google Glasses one more time. It was driving me crazy. I did like the quote he had when he said, think about what we want, then create it. I think that's a really good mindset to have. I think that is the direction we need to go. A lot of people talk about where we should go with healthcare reform, but nobody really is making big steps to improve it. So for his talk, it took place in the year 2020. So there are a couple of things that he said were happening in 2020. So I guess, would be happening in the future. The TED Talk took place in 2014 and it's 2018 now. So it's had 4 years to move in this direction. So I'm just kind of going to go through some of the things that he said were going to happen and talk about like where he's at. Overall, I thought a bunch of the points that he made were kind of unrealistic to expect, but I'll get to that. So one of the first points he brought up is that we should be making doctors more emotionally intelligent, and he said that we should do that by teaching them on social awareness, empathy, and relationship skills, like judge them based on that to get into like medical school and become doctors. And while I think it'd be great to have, more emotionally caring doctors, I don't think that's the direction that we need to move. I think that, our doctors should be based on, while patient care is very important and being emotionally intelligent is very important, I don't think that's the doctor's job. Doctor's job is to, look at a patient and figure out what's wrong and, prescribe medicine to fix that. And a lot of that is scientifically based. You don't want a doctor that's going to be letting emotions come into caring, because a lot of dealing with sick people is like hard emotionally, like dealing with kids and dealing with families, and you don't want emotions to be clouding their judgment when they're prescribing medicines and whatnot. Another thing he said that we should move towards sharpen their observation skills by looking at art. Well, I think good observation skills is important. I don't think that looking at art is really going to help that at all. That's more like an interpretation skill than an actual observation skill. But he said that we move towards team-based care, and that I absolutely agree about. I think it is really important and extremely beneficial to have more than one person consulting on the same patient, and it would really help a lot, especially since one person might think they're right and they're sure of it, but when they're offered a different a second opinion or a different viewpoint, then that might change their outlook, and that really help to better care for patients than just one person saying, oh, this is what I think it is, and I have nobody here contesting me, so that's what I'm going to treat them for, even if that's not immediately right, or they're missing a small detail, which even the best doctor, that's going to happen to the best of us. They're going to make mistakes sometimes, but having more people looking at the same patient will help with that. I don't think we're any closer to that, especially because most doctors, I feel like, don't really want to work with teams. And I mean, that's kind of like anyone. Like, you don't want someone contradicting you all the time, or telling you you're wrong. You don't want to hear you're wrong, but I think that's the direction we kind of need to move in if we're gonna make the healthcare system more reliable. One thing he also said was that we should bring in like probability experts and mathematical modeling in order to make patient care more reliable and be able to tell what's happening. Like, we have that technology, but take the guesswork out of diagnosing patients. But I have a friend who's a nurse, and from the way she talks about it, a lot of taking care of patients is kind of guesswork, because you can look at all the symptoms and those symptoms will match however many diseases, and you kind of just have to go like, well, this is what's most likely, even to the best of us. Like, you throw all those numbers into a computer and they'll come up with 20 different things, but a lot of it is experience based. And it was kind of a little hypocritical for him to say, you need more emotionally intelligent doctors, but at the same time, we're going to use mathematical modeling to diagnose patients. Those are, two opposite ends of the spectrum. While I think that mathematical modeling might help, I think that that's already kind of what doctors are doing, and I think it might be a useful tool for them, but I don't think that that should be relied on or should be the focus of where we need to go. He talks about fixing the patient experience, and I know he posted a video, like a little video within the TED Talk of a man going to the doctor, and it was that commercial for the telemedicine, which I think we do have telemedicine, but at the same time, telemedicine isn't gonna be you can't have someone at home and go, okay, well now take your blood pressure, tell me what your heart rate is, or listen to your lungs. Like, you need to go into a doctor to do that. I think the issue with patient experiences and that why it feels so rushed when you go to the doctor is because we really don't have enough doctors. Like, I mean, how many hospitals are near here? Like, if you get really sick, you need to go to the emergency room, you're probably going to Rex. And, the issue is not that they don't have enough people. It's that if you go to any emergency room right now, there'll be 20 people in there waiting to see the doctor. And probably 15 of them don't really need to be in the emergency room. It's probably nothing. But, at the same time, as a doctor, you can't just look at the patient and go, oh, you're fine, just go home. Like, you have to check them out. And that's, I feel, is more the issue of why it's so rushed and why, you go to the doctor and they're asking you all these questions, because they kind of just need to, like, figure out, like, right away, like, is there something seriously wrong here, and like, assess how sick they are. Another point that he states is more aftercare, and yeah, I definitely think that we need to put more time into aftercare, because I know I have older grandparents, and a lot of they go to the hospital a good amount, because as you get older you get more health issues, but they'll be in there for 2 days and then they'll go home and they'll be like, okay, well, you need to do this, this, and this, but they're not following up with them. They're just telling them the aftercare steps that they need to take. But that's not really helping, because if they knew how to treat what was wrong, they wouldn't have gone to the hospital in the first place. So, another thing that he talks about is DNA specific medicine, which, yeah, that would be nice, but I think we're working towards that. Like, that's not something that we're just like, oh, we don't want to do that. If we had the technology, we would be doing that. But on top of that, that's not going to be cheap. Someone has to pay for that. And a lot of the issues now are that people don't have the money to pay for the technology that we do have. So to have medicine specifically crafted your DNA, that's not going to be cheap. So overall, while I think a lot of things that he's saying in the video would be nice to implement, a lot of them I don't think are realistic, and a lot of them I don't think we just have the technology to do yet, or require more doctors or more funding or a whole slew of issues.